Hello, everybody. I'm Dr. Kale. We're here for another episode of the Breast Podcast Ever. I'm here with Sara Sable-Antry. She is a wonderful guest. We're going to talk about her entire story. We're also going to focus on her choice for revisionary surgery, and we'll talk about that. But I just wanted to welcome Sara. Thank you for joining us.
Thank you so much for having me, Dr. Kale.
Well, it's my pleasure, and I will turn it over to you. So tell us about like your diagnosis and kind of where things went from there.
Sure. I'm the lucky one. So I found out my dad was being treated for liver cancer in 21, and they couldn't figure out really how the best way was to go about treating his cancer. So they did some genetic testing, and at that point, it came back that he was positive for BRCA1. So my siblings and I, of course, pursued the genetic testing. Older sister does not have it. My twin brother and I both do.
Right.
And so it was interesting as a man with BRCA1, he obviously has some things to look into, but immediately I just knew I was going to pursue a double mastectomy as well as I did an extensive hysterectomy to start off with because I was petrified of ovarian cancer.
Right.
The statistics are obviously not as favorable, but what I was really surprised about was the sense of guilt I felt because I had it as an option. So many people are diagnosed, obviously, with breast and ovarian cancer, and reconstruction is an afterthought. So I felt really strongly that having the ability to really drive my destination and where I was going to end up, I felt really convinced that I needed to ask a lot of questions and try to really understand the pros, the cons, and make sure that I was emotionally making a good decision for me at that time.
Sure.
My mom had had a double mastectomy when she was younger, and it was where I grew up. Um, Gentlemen should have never been allowed to do surgery. It was a barbaric response. And so my vision of what breast reconstruction looked like was horrible. I spent a lot of time looking online, just trying to understand it. And then, of course, my biggest concern being in Columbus, Ohio, was where am I going to go? Who do I want to go to? And fortunately, I found you.
Well, thank you. Thank you. When you received the diagnosis that you had the BRCA gene, how did you process that? How did you know when you wanted to take the next steps in terms of preventing cancer risk? How did you decide what order and what to do things?
Yeah, that's a really good question because with BRCA1, it's a lot of different parts of your body are impacted. It's not just breast. I I have it's on my dad's side, and so my mom having had breast cancer, I witnessed that. But with my dad, he's one of six and two sisters. One had passed from ovarian and breast, and then another aunt has had both ovarian and breast, and she is still living. So I knew immediately this was obviously something that was very impactful to our family. Kind of always had a suspicion, but then when he was dealing with liver cancer and we saw it immediately come up into the genes, it was just very methodical. What is the first step? And the first step is just getting your testing done. Small world, but my next door neighbor was a geneticist at Ohio State. So she walked me through what that process looked like. I have been extremely fortunate that my husband has amazing health insurance.
Right.
So, in addition to not having to go down the cancer route to make my decisions, we also are very fortunate. Financially, this wasn't going to be a big impact to us. All of my surgeries have cost us very little out of pocket. I will say my husband is a bus driver for Olentangy School District, and he was a sniper on a SWAT team. He went from sniper to diaper, became a stay-at-home dad, but he specifically got a job with great health insurance. So we really were able to make really good decisions. Ovarian scared me the most. It has such a low 5-year survival rate that was my very first, okay, what am I going to do here? Columbus has some amazing facilities and doctors. Dr. Samani, who I think was one of your guests before, she's a
Oh, sure. Yeah.
fantastic gynecologist.
Right.
So she did my hysterectomy. I had an oophorectomy, hysterectomy, everything gone. Surgical menopause happened immediately, which I was not prepared for. There was a lot of mental kind of shift with that. You just don't realize how much your femininity is locked into some of these things that you take for granted. Um, Overcoming the hysterectomy, it was done laparoscopically, so it really wasn't that big of a deal. It was my first surgery, so it was,
Okay.
it just didn't seem like it was that big of a deal. Um, but it was very, for me, it was a no-brainer. I hate to use that term because it means other people who are challenged with that decision. It's not that they're not thinking it through, but for me, it was just such a natural next step. So had that done in February, 2 years ago, right now, February of 22. And by March, I was meeting with breast surgeons. I was really trying to understand what are my options. Um,
What was the timeline difference between your diagnosis and the hysterectomy?
3 months.
About 3 months. So you moved pretty quickly.
I wasn't messing around with it.
No.
I'm 46. I was 44 at the time when I was diagnosed with all of this. So statistically, starting to get into that time period, you've gotten to know me pretty well over the last year, but
That's
I've got some pretty big demands on me from professionally, and I travel a lot. So I was looking at, okay, when does this fit the best into my life? Two teenagers who are really active, and we travel a ton. So getting through the holidays was my primary. I wanted to really have some normal holidays, knowing that this was a long term strategy. So had some great holidays. Actually ended up with COVID that year, so we had Bob Evans for Christmas dinner. It's just, it is what it is, right? Make a
yeah.
plan, make God laugh. Um, so got to the holidays, got the kids back in school, and then yeah, within 3 months of finding it out, I was done with my hysterectomy, and then the focus became breast.
Okay. So walk us through the next steps after that in terms of your decision as far as mastectomy and timeline and so yeah, walk us through that.
Yeah. If you're a middle-aged woman, you've met numerous people over the course of your life who have gone through this. So I've had so many friends over the years, family members, and first thing I started to do was just ask questions. And a lot of it was, what decision did you make? How did you make that decision? Any regrets? Because I really wanted to sort of, I like to mitigate risk. That's something I tend to look for in life in general. So my thought was, if I end up finding out a lot of people who've decided to live flat are the happiest people out there and they've had no complications, it wasn't something that I was truly considering, but it would have
Sure.
increased my consideration. Um, I was very hesitant to learn more about implants. From day one, I really just thought an implant is not going to be something for me. And honestly, at that time, I was only aware of implants and living flat. So I really felt like there were these two extremes, and they really would have had such a disruption in my life. It was, where do I want to go next? I mentioned my mom, as barbaric as her surgery was, I'm not kidding. Her scars are probably 5 inches thick. And wearing a mastectomy bra with silicone implants, it's very painful for her. So
Uh,
she really has lived flat. And I thought, I don't want that. I do a lot of presentations on stage, and I wanted to look nice. I wanted to look put together. So when I started looking at implants, then of course you start learning more about removing them, because there have been issues with implants. And for the
sure.
folks who have chosen that course, very happy for them. But I thought, I am so high risk. I really don't want to introduce something else into my body that could potentially mask cancer. So I was very concerned about not having something else, another complication. I've heard from many people they can be very uncomfortable. You can reject them, and then of course they can shift, and then you have to have them removed. So the first time I went and met with my breast surgeon from Riverside through Ohio Health here in Columbus, I was shocked to hear about DIEP Flap. I had no idea, and I wouldn't say that I got excited, but I definitely started having that mental shift that I might be able to maintain my sense of femininity, my sense of looking like a woman, feeling like a woman, and to find out that Midwest Breast here in Columbus is one of the top that does this procedure in the entire country. It almost felt like, okay, this is this is meant to be, continue having this conversation. So at that point, I scheduled my mastectomy for October. And I'm sorry, it was tentatively scheduled for October. And then I had a couple months to kind of make my decision about what that would look like. Because when you have your mastectomy, it's okay, are they just going to stitch you up and you're done? Are
Sure.
they going to put in expanders? And then with the expanders, what was the next decision?
Right.
And then I came to see you.
Yeah. Well, I know that you met my partner, Dr. Kochak, first, who's also
I did.
one of our partners, and he's amazing. And I know that you guys had met, and kind of where we met was at that first surgery where we started with expanders. So, kind of
Mm-hmm.
walk us through ultimately for you, you did the deep flap in two steps, starting with an expander, then transitioning over to the deep flap. Like, kind of walk us through that process. What was that like for you with the expanders? And then, ultimately we'll talk about the deep flap operation.
Sure. I think when you are making these decisions, I like to get as much information from people. I like to get subjective and objective. So you can go down a lot of rabbit holes.
Sure.
But I also feel like most women in my situation, when you're on the other side of it, you want to tell your story as much as possible. So people who are at the early stages and are looking for information, you can kind of get a wide range. I found the staff there very, very helpful. You actually have one of your front office ladies has gone through the deep flap, so I really picked her brain. Your PA, Caitlin, is absolutely amazing. Being able to have that sense of, okay, here's what we're going to do, here's what's next. Um, I did make the decision very quickly that deep flap was going to be the right fit for me.
Okay.
So the other thing that I understood was it's not a short term fix. This is something that you need to be prepared for. It's going to probably be at least a year from start to finish. And you can go shorter, of course, based on your own timeline, but from a healing perspective and everything else. So it felt like there was a bit of a ticking time bomb. It felt like the longer I wait, the more likely I am by complicating this and actually being diagnosed with cancer. So I definitely felt this sense of not urgency, but a sense of get the information, make the decision, and let's move on this.
Sure.
The expanders made sense to me because I didn't want to live flat. I had already ruled out the silicone implants, but what I also with expanders, you have both options, etc. So you're correct. I met with Dr. K, fun guy. It's crazy. Every time I leave her office, I'm always laughing, and you make a very serious situation. You can appreciate it when you walk out of there. And then we scheduled it. So for those who don't know, you have it all done in one day. So you have your breast surgeon who comes in, they do the double mastectomy, and then you and Dr. K, I think both came in and you handled the expander implants. I was shocked when I woke up. Um, you're very numb. You don't feel a lot. It's really shocking, quite frankly. And then after a couple of days, the nerve pain started. And what really shocked me was the expanders. I felt like I had a bear trap on my chest. It felt really sharp. And it was just, it's not, obviously, it's mesh. It's nothing sharp at all, but it's the way my body reacted was it felt like metal, sharp metal. So the nerve pain from the mastectomy was definitely, I would say, in all of these, probably the most difficult over the next couple months to heal and get there. When you do the expanders, I think I took maybe 2 months to heal from the mastectomy, and then I would come to your office every week, and I would get syringes where it's really cool. There's a magnet under your breast skin, and on the outside, the syringe binds it, locates it, it goes right into the skin, and you walk out, and you've all of a sudden got an extra cup size. So it didn't take very long, but and these are all decisions that you help with. What is your goal? What size expander should we put in? So if you want to be an A cup or a double D cup, those are all things that you, of course, wanted to talk about beforehand. So we had our game plan, and then we started the fill, and I think it took just 6 or 7 fills maybe because I wanted to be. I'm 5'10". I wanted to be proportioned, so I wanted to have about a B cut or a D cut. And it was not painful at all. My skin stretched very easily. And so, really, going from in October of 22, probably by February of 23, I looked normal. I looked like I had a normal breast volume. My skin was accepting it. We were doing really well there. And then the next decision came. We knew I was going to do a DIEP flap. And so, again, I looked at my schedule. I mean, talk about DIY healthcare. We can literally plan these things.
Right.
Yeah. And I think one of the other things is the way that your facility handles it. You have your own surgical center. So I literally was the only patient overnight for an entire weekend. The nursing staff was
Oh,
absolutely phenomenal.
you're talking about in Springfield, Ohio,
In
at
Springfield, Ohio,
yes,
yeah.
Ohio Valley
Ohio
Surgical.
Valley Surgical, yeah.
Yeah,
I
they're
mean, I can't
fantastic
say
over there.
enough. Amazing, amazing,
Right.
amazing, amazing things.
So
Wonderful
for our,
care, beautiful.
so for our audience that's listening, we're talking about the surgery where we
And
removed the
sorry, yeah.
expanders and did the deep flap. Yeah.
Yeah, so you go in, and the pain I had from the mastectomy, from the nerve pain, I sort of had in my head, wow, this is a really big surgery. So with the deep flap, the option for me, and the reason I brought up the hysterectomy earlier, one, it has to do with my BRCA history, but it changed my body. I immediately had that, um, I forget what they call it, like it's your belly kind of has like that apron belly effect. A lot of people who go
Okay.
through hormonal belly, kind of the menopause thing. So I didn't really care for how my body was looking at the time. Still in the back of my mind, feeling really guilty that I'm able to take advantage of all of this, and we could afford to do it, and we had health insurance. But a deep flap is basically removing all of your abdominal tissue and transplanting the fat into your breast cavity that's been created by the expander. So,
Right.
yes, the benefit of a deep flap is you get a tummy tuck, and you even created a belly button for me. So it looks very natural. Uh, I came out of there, and my abdominal scar was about 26 inches from right hip to left hip, and it healed very, very well. It looks really good. You don't notice it. It's, maybe 2 inches above my pubic area. So from, if you want to wear a bathing suit, go for it. I don't my 40s, but it looks very natural. I look much better. So I really benefited from the deep flap by simply having that. And then being able to take the expanders out, that was a sense of relief. I definitely felt that hardware. So to not have it anymore, and I literally woke up, and all of a sudden I have larger breasts than I've ever had, very natural feeling. And that was in end of July. I had that done, and the abdominal healing was probably the most difficult. You just don't realize, of course, your core, etc. So I would say it was probably a few months before I really felt kind of myself abdominally. But the deep flap procedure itself, from a breast standpoint, was, I don't want to say easy, but it was much easier to deal with than the actual mastectomy part of it and the expanders. So the deep flap for me, absolutely the best choice. Absolutely the best choice. And I've had very little issues since, but we did need to do one revision.
Right.
And the revision itself is where I chose fat grafting.
Right.
Um,
So that's
and
really
I,
important, like with the revision. So, you know, walk us through the revision surgery. A lot of times patients will ask me, like, how many revisions do I have to have? And, typically I just let them know really that revision process is determined by you. So it could be zero
mhm.
surgeries, could be more than one surgery. So for you, you decided to have a revision surgery. Tell us about that. Like, tell us what made you decide to have a revision surgery and the process that then followed in terms of how we decided what to do.
Yeah, so I think going into this, again, I sort of knew I was in it for at least a year or so. I just very mentally had that nothing's going to work perfectly the first time. And if, it's covered by insurance in my situation. So if I wanted to have something tweaked, fixed, whatever. But what actually ended up happening is my left breast, I ended up getting a little bit of just kind of some harder tissue, and then my right breast kept its fullness. So I had some asymmetry, and I wanted that addressed. So we
Okay.
talked about what our different options were, and it was, oh, you could put an implant in, which would be kind of a quick fix and in and out. But again, I didn't want to have an implant from day one because I didn't want to have any issues with further MRIs and looking for cancer detection.
Right.
So you started explaining to me this fat grafting, and all women would make this joke, but I've got plenty to give, and I did at the time. So you took a look at my body and the different areas where perhaps you could graft it from. So I did have some areas. We talked about the pros and cons of how it would impact on your hips, your inner thigh, your lower thigh, the contour of how your leg would change. So I met with you and a couple other folks. I read a lot online, and I decided to do fat grafting from kind of my lower thighs above where like my knees are.
Hmm.
Um, in my mind, I was probably going to have to do it 2 or 3 times just based on what you see online. And people say, oh, I've had 8, I've had 0. So I sort of was saying, oh, I might have 2 or 3 of these. So if I start in the middle of my front thigh, then maybe I'll do my inner thigh and maybe my outer thigh.
Right.
Not a difficult process. You have another facility that you go to. And so we had met and you decided, all right, we're going to take from here. I think we're going to need to remove this amount of ml and fat. Expect that some of it will go away. I was also very proactively trying to lose weight at the time. So it was all these different things that weighed into it. And it through liposuction, you went in. I have 2 small scars at the top of my thighs where it looks like you maybe went down into the fronts.
Correct.
And that day it was an outpatient surgery. No, was that the outpatient one? Yeah.
That was outpatient. Yes.
Yeah,
Yeah.
this was like an outpatient. This tells you
Yeah.
how, right? This was just gosh, it's been about 7 weeks ago. So
Yeah.
just about 7 weeks ago I had this
Mhm.
done. And I
Yeah.
just traveled this week, so no downtime whatsoever. I had people tell me, "Oh, you're gonna hate liposuction. It's the worst thing in the world." I'm like, "Yeah, hold my beer." Like, I had a deep flap. I had a mastectomy. I'm good on
Right.
liposuction. So it was an outpatient surgery. I was in and out within a few hours. You have to wear Spanx. I highly recommend Spanx, and you need from your navel down to right above your knees. Look for the ones that have the holes in them because you wear those for about 4 to 6 weeks. Because, like with any kind of liposuction, you have to have a lot of compression. And you did minimal on my right. That was just a little bit, but my left was the one again that had a little bit of a hard tissue, so you were going to remove that, and then I had lost some. So from an asymmetry standpoint, the goal was to remove, I think it was maybe around 200, 300 mLs total,
Mhm.
and get the symmetry, which you have. And it's interesting because my right breast, you didn't have to open my flap up again, and that surgery was in October. You can barely see the scarring now. I have the football shape from when you did the flap, the abdominal, but you can barely see the scarring now. My left breast, again, it's been, 7 weeks or so that it's been open. The scarring looks, again, phenomenal, but my breasts are extremely symmetrical. They are in a good position where I want them to be. We were in Florida last week for soccer. These are parents I haven't seen for over a year, and immediately everybody was like, "Oh my gosh, you look amazing. What have you been doing?" I'm like, wink, wink. I had surgery.
Well, I
Honestly,
mean,
it's the most.
you did some other things outside of surgery, so
I lost some weight. That helps, right?
yeah.
But
I mean, that's a big help. Yeah.
but it's been 2 years, and I never thought I would have. First of all, the sense of relief when you go from, hey, you are very statistically going to have a few types of cancer, to now 2 years later, I feel good. I feel very confident in how I look. I have such a sense of relief that I was able to do these preventive surgeries and not have to deal with what so many other women deal with.
Correct.
It's a gift. And so now I feel very, very focused and dedicated to trying to be just healthier in general. What a shame it would be to waste all of this by being, unhealthy in general. But the fat grafting to me, my breasts feel extremely natural because it's just fat. So everything looks natural, it feels very natural. Um, when I wear shirts, nobody would ever know that I've had any kind of extensive surgery. So for me, it was the most natural way to go about it. And it also had very little downtime for me. You gave me the all clear in January to resume kind of physical activity. So I've
Right.
done yoga again. It's difficult, my arms, it's going to take a long time to get that back. But
Sure.
I just can't believe the amount of short term progress that I've been able to experience in using my own natural body materials. Really just felt the right way for me. But I also now, I've had very little rejection, very little scarring issues. It's such a natural process. I know that's weird to say, but I don't want anything foreign in my body. So this really gave me the opportunity to look and feel as good as possible.
Sure. So, for our folks who are interested in fat grafting and have
Mm-hmm.
yet to undergo the procedure, what kind of advice would you give them in preparation for fat grafting? In terms of what to expect and also like how to prepare for the after surgery care. I know you had mentioned earlier about making sure you have a compression garment. Any other things that
Mm-hmm.
you might recommend for somebody?
I would say make sure you're looking at, is it a disruptive time in your life? Because you're not going to want to go to the grocery store. You need a good, I think, 2 to 3 weeks before you really feel that strength come back. I did this with the mastectomy, but a shower chair. I think that's really important because you do have a lot of bruising. I mean, it's liposuction. So if you've ever looked online, the cannula that's used to break up the fat, the fascia, it's tough. So a lot of bruising. I think mentally you've got to be prepared to see that. Putting Spanx on in the best of days is difficult. Doing
Sure.
it when you're extremely bruised, it hurts. It does hurt. So having someone available the first couple of days to just sort of help you get that pulled up and in place. Lots of comfy jammies, lots of pillows, and just sort of knowing that you're going to be home for a couple of weeks.
Okay.
Yeah, the don't buy your stuff on Amazon. Those are all junk. Get the Spanx. They're like $24 at Macy's, and have like 4 or 5 pair because you'll wear them for probably 2 or 3 days and then need to, have another one ready to go. But the Spanx to me were probably, of all the things, probably the most annoying because I
Okay.
just didn't have a ton of pain. I really didn't. And honestly, the results were so good. I was so happy with the results that, to deal with a couple bruises for a few weeks, it's a mental thing. You really just have to mentally remind yourself that you're coming to the end of your long journey, well deserved to feel good at the end of it. And I do think fat grafting, it was a gift. It really was. A lot of people are like, so you got a tummy tuck and a boob job. I'm like, yeah, I did. And a natural one at that. So you can
Right.
always put a good spin on it that way. It's mental.
Sure. Now, you talked about the bruising, right? And we had taken the fat from your thighs.
Hmm.
So, what did the bruising look like? Did it extend? Did that bruising sort of extend beyond where we took the fat from, and how long did it last?
I still have in the areas where you took it, you can
Yeah.
feel like rigid skin tissue. I'm assuming that's almost like where the cannula went down or something because you can feel it. It's breaking up over time, but again, it's only been 7 weeks. It really hasn't been that long. You can definitely tell, like in the contour of my thighs, it stayed where it doesn't look like divots by any means. It looks natural, but my thighs are definitely thinned out where it was removed.
Hmm.
I mean, imagine the fat came from probably maybe 2, 3 inches above my knees, but I
Hmm.
was bruised up to I was bruised almost up to my hips.
Okay.
Now it wasn't as bad, but I mean, it was black. It was black bruising where the immediate sites were. And then because the cannula, I hope it's called a cannula. I'm making up
It's a
words
cannula.
here,
Yep,
but
you got it.
okay, good.
Yeah.
um, up by my thighs, so probably maybe 3 inches below where my underwear sits on my thighs. That's where the holes were, where the cannula went down. So you sort of had this really dark, dark bruising at the lower point, kind of more of a red mottled look all the way up to where the incision was. And then where the incision was, then it was black again.
Okay.
But yeah, I mean, your whole thighs, the backs of my thighs were bruised, even though you didn't touch that part of it. It's a lot of stress on your immediate area. So you will definitely bruise. They looked worse than they felt within 2 weeks. And then all of the bruising, it probably took about 5 weeks before all of the bruising was really gone.
Right. And did it sort of evolve in different shades of black and
Oh,
blue
yeah.
and yellow and green? Yeah.
Yeah, I mean, it was, don't do it during summer, maybe,
Okay.
for
Okay.
someone who doesn't want to, if you wear a lot of shorts. Oh, yeah, I mean, it was as dark as my shirt. So I have on like a black navy blue shirt, and then
Right.
it went to a beautiful purple. I had really dark red. It looked just almost like a really dark, like mulberry red color. Then we kind of went green, and then it was a ugly kind of yellow on the way out. But yeah, it was the United Nations of bruising there for
Yeah.
about 6 weeks. It
All
went
the
through
colors of the
everything,
rainbow for sure.
all the
Yeah.
colors of the rainbow.
All right. So yeah, bruising, and then what about like the swelling and the pain in your thighs from where we got the fat from? How would you let our listeners know what that felt like?
So I had a girlfriend who told me she had elective um, liposuction, and she was like, "Girl, it's a 10. It's a 10. It's the worst thing in the world." I thought, okay, well, I might have a little bit of a different perception on pain after a mastectomy and the DIEP flap.
Right.
I would rank the double mastectomy with the nerve pain is probably the most pain I've had. I would say that's probably like an 8 or 9. I think the DIEP flap breast area was 3, 4,
Okay.
honestly, but the abdominal area I would say was probably a good 6. Now for the women back
This is
home,
during the deep flap, right?
this is the DIEP flap. Yeah, the
Yeah.
DIEP flap
Okay.
breast was just, I didn't think it was that bad. I really didn't. The expanders I did not enjoy. I did not like the expanders for the first couple of weeks. And then once I started to regain feeling, I went from numb to nerve pain. So that's why I would say that the mastectomy itself was the worst pain. Um, my oldest child was a vaginal birth, no epidural with an episiotomy. So I would say that was an 8 for all
Okay.
the women going through this. The mastectomy was up there. But with the mastectomy, you're dealing with that pain for weeks versus childbirth. You forget about it within a couple hours and you love the thing no matter what, right?
Right.
So I think the prolonged pain of the mastectomy was what ranks it so high for me. And
Okay.
again, it was from numbness to nerve. Then the DIEP flap, breast 6, 3 or 4, DIEP flap abdominal 6 or 7.
Mhm.
So for me, I felt like the fat revision was a 3, a 2, or a 3. I mean, it just really didn't constitute much after everything. It was more that bruising. The bruising itself is what hurt, but it was a momentary pain. It was literally if you're pulling up your Spanx and that really tight compressive fabric hits a bruised area, it hurt. But it was more, you're done. You put them on, you're in place. So the fat grafting to me was nothing.
Right. Now, obviously, on the one breast, we had to do a little bit more work and make
Mm-hmm.
larger incisions. That was, as you had mentioned, you had an area, a hard spot, which we call fat necrosis, that we addressed. Um, the areas that we didn't have fat necrosis, where we didn't have to open things up, like how big were the incisions for the transfer of the fat into the breast and for the harvesting the fat, just to let
So
our
harvesting
audience
the fat, I mean, the scars from that are probably about the size of a dime, one on each thigh.
know. Okay.
Very, very, very little, very little. I could wear shorts today and no one would know that I'd had anything done. Um, so my right breast, because you didn't have to open the flap up minimally, just peeled it back a little bit. My right breast, it's very difficult to tell that I even had a second surgery
Okay.
because you were able to just, pull it back just slightly. A DIEP flap. surgery looks like a football. So it's fat coming off of your abdomen placed on your breast.
Right.
You didn't really have to do much on that. On my left breast, you had to peel that flap back. And so that flap itself has my incisions honestly are less than in the largest places area, which I had a couple areas where they say don't take a shower or a bath and get your incision wet. And the reason they say that is because if your scarring doesn't heal well, it actually spreads that out. And so I did that on my own. At 6 weeks post mastectomy, I couldn't wait to get a bath and read a book. So I
Okay.
actually ended up causing a little bit more scabbing on my left breast. So at the thickest point, it might be 3/4 of an inch, but
Okay.
all the way around, it's probably more, maybe 1/4 of an inch,
Okay.
maybe. And red in the parts that are newer. Right breast, it's down to almost a white, barely visible scar. You can barely see it on my right breast. Left breast, it's probably about a quarter inch red all the way around that football.
Okay. Um, Now, do you have any drainage? So obviously, for for our listeners, we have to when we do liposuction, we've got to use some fluid to help us harvest the fat. So, did you have any drainage from the thighs or your incision site?
Very minimal. You come home with some fat gauze, kind of steri stripped onto it. I actually took that off because putting the Spanx on and off, it's hard to get that. So I actually did not have any kind of drainage. I had scabs that probably stayed for 3 weeks. So I just kind of kept a little aquaphor in that area just to keep it. But no, very, very minimal scarring, very minimal scabbing. I did not have drainage. That was the best thing about fat grafting. I didn't have to have drains in general because I had two with mastectomy and
Oh
two with
yeah.
the DIEP flap, and I hate drains. Drains are honestly like if you could figure that out, Dr. Kale, for us to never have to have drains. I know that's not possible, but I don't think people understand how freaking uncomfortable those things are. So I was thrilled to not have to have drains for the fat grafting
That,
procedure.
that is a big benefit of fat grafting compared to some of the other revisionary surgeries.
Yeah.
Well, that was really good, especially just giving us your history and your experience with fat grafting. What are the next steps for you in terms of reconstruction, but also life?
um, it's really given me a completely different perspective. So I kind of have always been a run hard, play hard kind of person and didn't really focus too much on my health. It's really given me a completely different shift in healthcare. I know I keep saying this, but what a gift to be able to have gone down this path. So I think to not be a bit more serious about my overall health, learn how to sleep, get back into yoga and, get my
Right.
core strength back up. That was something that you really take for granted. Your core strength is completely gone after all of this. So I have a very different just focus on me and allowing myself to sort of take advantage of things, slow down a little bit. It's very bizarre how mentally this impacted me for the better, long term. So focusing on my health, continuing to do that. As far as we're going to give it a year. So next December, I'll come see you again, and we'll
Okay.
see if there are other revisions that are needed. After going through the fat grafting revision, it was so easy that if I'm not 100% satisfied, if I want to go larger or maybe some asymmetry, then I would do it again in a heartbeat. It was very easy to work into my everyday life.
Right. Well, I thank you. I think one of the things that, I've taken in working with you is how to find something positive out of a potentially stressful situation. And it seems like that's what you've done. Um,
Thank you.
yeah, so congratulations. Yeah. And
Well,
thank
you
you.
and your staff have been absolutely amazing. I can't thank you enough for this gift.
Well, I appreciate it. And thank you for trusting us through this process. And, most importantly, thank you for sharing your experience because, I think it's important to put it out there and, for all our patients who don't know kind of what to expect, not only in the entire journey, but also, for specific parts of it. Like, what better way to get that information from directly from someone who's gone through it. So thank you for
Yep,
taking the time to
of course.
share your story.
Of course. Thank you.
All right. Thank you very much.